The Medical Education Collaborative, in cooperation with the Fistula First Breakthrough Initiative and SciOS Continuing Education, is pleased to present Cannulation of the Arteriovenous Fistula. This activity has been made possible by an educational grant from Amgen Incorporated.
Welcome to the Cannulation of the Arteriovenous Fistula, a continuing education program designed to increase your understanding of the importance of AV fistulas, as well as your knowledge of the techniques for assessing, cannulating, and protecting both new and mature fistulas. This knowledge will help you to develop the critical thinking required to troubleshoot problems that may arise during cannulation and dialysis, and to communicate more effectively with physicians, surgeons, and other members of the care team. You will hear fistula care information that reflects the most current evidence-based clinical practice guidelines from the National Kidney Foundation's Kidney Disease Outcomes Quality Initiative. It is our hope that this program will encourage your healthcare team to develop a new AVF cannulation protocol for your hemodialysis center as part of your vascular access policies and procedures. Hello, I'm your narrator today, and I will guide you through this program with the assistance of 3 clinical experts. Dr. Lawrence M. Spergel, Clinical Chair of the Fistula First National Breakthrough Initiative based in San Francisco, California. Linda K. Ball, RN, Quality Improvement Coordinator at the Northwest Renal Network based in Seattle, Washington. And Deborah Brower, RN, Director of Therapeutic and Clinical Programs for Renal Solutions Incorporated, a company based in Warrendale, Pennsylvania. Before we hear from Dr. Spergel, let's go over some of the important features of this program. In addition to the commentary provided by the clinical experts, you will find a list of resources used in developing this program. To access any of these tools, simply click on the appropriate icon on the main menu. Be sure to check the menu for the post-test and information on submitting that post-test for CE credit. Now, a word from Dr. Larry Spergel. Dr. Spergel is responsible for guiding the development of the content of this educational program.
Hello, I'm Dr. Larry Spergel, Clinical Chair of the Fistula First Breakthrough Initiative. It is my pleasure to introduce this wonderful AV Fistula Cannulation program, prepared by cannulation experts as well as other clinical experts, all of whom are members of the Fistula First Breakthrough Coalition. Fistula First is a national healthcare initiative sponsored by CMS, or the Centers for Medicare and Medicaid Services, the goal of which is to improve and optimize the quality of care for our hemodialysis patients, and specifically to ensure that they have the opportunity to have a native fistula for their chronic hemodialysis as opposed to a graft or a catheter for dialysis. The reason for promoting AV fistula use on a national level is because AV fistulas have been shown to be associated with the fewest complications and the lowest costs. And unfortunately, in this country, we have the lowest prevalence of fistula use compared to other developed countries. However, to ensure that the fistula has the fewest complications and the longest survival, it is crucial that the fistula be cannulated by skilled personnel, whether that be the staff or the patient. Lack of the necessary skills required, both to cannulate the fistula and to care for the fistula, will lead to complications and can lead to the loss of the fistula. This is why cannulation training and education was chosen as one of the 11 change concepts, or concepts for improvement, in the Fistula First program. Thus, the importance of this cannulation training program. At this point, I will turn you over to the cannulation experts, and I hope that you will find this program helpful in the care of your patients.
Thank you, Dr. Spergel. Indeed, poor cannulation technique and improper care of the fistula can lead to a range of complications, including loss of the fistula, further hospitalizations, creation of temporary access measures, great inconvenience, disruption of the patient's regular treatment regimen, and higher costs. A native arteriovenous fistula, an AVF, is the best vascular access we can offer patients. This is where the patient's own vein is surgically connected or anastomosed to an artery instead of being bridged to the artery with a prosthetic material or graft, or having a plastic catheter inserted into a central vein. As Dr. Spergel pointed out, fistulas have a number of advantages over these other types of accesses. Fistulas are associated with the lowest failure rates and the fewest complications, such as infections and stenosis, the greatest longevity, and the lowest costs. However, many dialysis nurses and technicians are more accustomed to using grafts and catheters and often lack the proper cannulation knowledge and skills required to care for patients with fistulas. This continuing education program will help these dialysis professionals learn and practice the very best in cannulation and fistula care techniques. Cannulating a fistula is the formal description of the process of inserting needles into the vascular access, and it is technically more challenging than cannulating a graft. Although you may sometimes hear the terms placing, sticking, or needling in common usage, we have chosen to use the more formal term cannulation throughout this program. I hope that you will find this program helpful in the care of your patients. During the course of this program, we will discuss the new fistula, how to assess it for maturity, complications, and suitable cannulation sites, and the correct way to cannulate it. We will then move on to the mature fistula, how to assess it, how to select and prepare a site for cannulation, and how to cannulate using two different techniques, site rotation and the buttonhole. We will also discuss the benefits of self-cannulation for patients. Finally, we will review in detail the fistula-related problems that may occur during cannulation and dialysis. Before I introduce our clinical experts, I would like to remind you that there are tools on the main menu for your use, and you can gain access to the resources provided by Fistula First by going to www.fistulafirst.org.